Hello everybody and welcome. Thanks for joining us. Thanks for your interest in the topic of today's webinar. We will be speaking about harm reduction for recreational use. This is a emerging topic. It is gaining interest and attention on the global agenda, and it is quite necessary since, especially for our region, since the use of new psychoactive substances and methamphetamine and other synthetic drugs is on the rise, but at the same time, we are lacking attention to this topic in our programs and don't always know what is the best way to approach this and how to approach donors when we are talking about this and trying to find some ideas for our programs, how to best help this group of people. So this is what we will be talking about today. Just a quick couple of technical things. So my name is Maria Malachova. I will be moderating today's webinar. You have all seen our agenda. So we will have 4 presenters. And at the end, we will have a Q&A and discussion section. This webinar doesn't allow you to talk and participate during the speaking, but you can use the chat during the whole webinar, and please do use it. Please do leave your questions or comments, and we will be keeping track and answering them as we go along, or leaving some of them for the discussion at the end. Okay, so just a quick reminder for those who are joining, please do choose a channel in which it's most convenient for you to listen to the webinar. We have 4 language options today. And with this, I would like to present the first speaker today. This is Slava Kushakov, Senior Advisor at Alliance for Public Health, who will be opening today's webinar and giving us an overview on why this topic is important and how we can approach addressing it in our work and our programs. Please, Slava.
Hello, everyone. I would like to thank everyone for joining this webinar. I have to stress that this is a very collaborative work and many partners contributed to what we are going to present today. So we encourage this collaboration and hope that we will work together on all these issues. We don't exactly know what to tell you, so be as active as possible with questions and also stay in touch for the future with the organizers and with us if you have any practical questions. We want to make it as practical as possible, and for example, for raising funds for this important work. And I know that many of you are thinking of the possible funding sources for this work, including the Global Fund, for example. And I have to stress that the Global Fund is starting to support working with recreational users. And the Alliance in Ukraine is using some of the Global Fund funding, so we are also very keen to share this experience with you. It takes quite some time for WHO to issue guidance on things, so when it comes to working with people who use in recreational context, there is no explicit WHO guidance yet, including guidance on drug checking. But I'm sure it will be forthcoming because there are a lot of studies currently being implemented across the world, and we are getting more and more data that supports the implementation of these programs. And also what's important is that the community of people who use drugs is very active in promoting these approaches. And without this strong push from the community, we would not be able to achieve anything. So again, thank you everyone for being in this business, if you like. If you shift to the next slide, please. Thank you very much. So these are busy slides. You don't have to read them. I think the organizers will share the slides with you after the webinar, so you will be able to double check some of the things. So I'm not kind of exactly following the text here, but I wanted to highlight that we are witnessing the shift in the paradigm in the relationship between the humanity and psychoactive substances, and essentially the developed world is shifting from repressive, from criminalization to approaches that are more focused on public health, on human rights, and on harm reduction. So this is something that is happening now, and it continues to happen. Not all the countries have joined this shift yet, but it's coming. Well, there are plenty of reasons for this, but the essential points, the essential parameters of this shift is the more complex relationship with substances, more deeper understanding of the substances, their effects, potential risks and harms, and also ways to overcome those risks and harms. We are understanding now that the substance use is a very complex phenomenon. It involves multiple substances, multiple issues, multiple ways to use the substances, risks, and harm reduction strategies. And it's very important to be as detailed and as nuanced as possible here. Essentially, it's very important to understand that apart from problematic drug use, apart from injecting drug use, there are other ways that people use drugs in, and it's very important to work with all those other ways and other subpopulations in the community of people who use drugs. Although people who use recreationally, they are not always developing problems with drug use. Probably 1/10 of the population will develop significant problems such as substance use disorders and other health challenges. But it's very important to start this work as early as possible, because if you develop this connection with the community of people who use drugs early, at the time of the first experiments with substances, then we are able to maintain this connection throughout their lives and offer services when people need them. Early start of this work with people who use drugs is very significant, and this is one of the most important things to mention. If you could switch to the next slide, please. Yeah, so there are plenty of benefits to work with people who use in recreational context and people who experiment. As I mentioned, the earlier we start, the better we're able to offer services in the future. We build this connection, build rapport, and we can prevent many issues that can arise when people use substances. One of the most significant, perhaps, for this particular community is acute poisoning and overdose. And there are plenty of tools that we have now that we can actually use to prevent lethal overdose, prevent threatening intoxication. We can also earlier start to work to prevent HIV infection, including pre-exposure prophylaxis. Essentially, we promote more conscious, more mature, more comprehensive, more nuanced relationship with the substances, understanding of the substances, and we also improve our knowledge of the drug scene, improve our knowledge of the strategies we have to reduce the harm. If we could shift to the next slide, please. Thank you very much. So just briefly about the arsenal of tools that we have to offer services to people who use drugs in experimenting and recreational context. First of all, is access to information, which should be objective, reliable, unbiased, and as comprehensive as possible, detailed. Then we also have a range of harm reduction products for people who use. If it comes to people who do not inject, we can distribute sets for safer sniffing and a range of other products, which my colleagues will explain in the presentation. We also include services related to sexual, reproductive, and mental health. Also services to support people who experience challenging states, emotional states, physical states. And one of the examples here is trip sitting, which we may touch upon. And also, I would like to stress the importance of peer support, mutual support within the communities of people who use. Next slide, please. Thank you very much. So I wanted to tell a little bit more about drug checking, which is probably one of the most important services for people who use substances in recreational context. Essentially, drug checking is allowing people to have the substances analyzed before use or after use, ideally before use, so that they understand the actual composition of the sample that they are about to take, and thus they can avoid the overdose, they can choose the appropriate dose, then can avoid dangerous adulterants, psychoactive substances that they are not willing to take, and also some dangerous combinations of the substances. Uh, the drug checking now exists in more than 20 countries, and more studies are on the way to show their usefulness in multiple things. Essentially, they are useful for monitoring the drug market and for understanding which new substances are emerging on the market so that we can prepare our responses. They can identify adulterated drugs, monitor patterns of use, and collecting data for harm reduction programs. Also pointing to unexpected substances in samples and informing clients about the potential risks. It's in ideal circumstances when we do drug checking, we actually work with people individually and explain the results of the tests and also all the associated risks and strategies to reduce them. We can also assist users in defining safer dosing, avoid particularly harmful combinations of substances, and also avoid dealers who are selling dangerous substances. There are many benefits, and more and more studies are showing the effectiveness of drug checking services for changing the behaviors, and many people are actually deciding not to take substances that bring negative or undefined results. Uh, in terms of technologies, there are different technologies that are used for drug checking. If it comes to non-governmental services, probably the easiest and most common are the use of Fourier transform infrared spectrometry, and also use of colorimetric reagents. And we can talk more about this later during the webinar. But essentially, whatever technology is available, we encourage you to use the technologies that you can use today. In Ukraine, for example, we cannot collect samples from people who use drugs, so we can only distribute colorimetric tests for now for people to use them at their convenience. And it's very important to actually give clear instructions on how to use the test, how to interpret the results, and also explain the limitations of this technology, because colorimetric test is the most basic technique to check your substances. So the sooner we start using more advanced technologies as spectrometry, the better. So, and actually the only obstacles for doing this is the legal conditions in our countries and continued criminalizations of people who use drugs. Next slide, please. So the Alliance and our partners in other countries, we are actually working on a range of documents that will help practitioners to organize the services and to also advocate for the introduction of these services. We have issued the policy statement on harm reduction work among people who use drugs in recreational context, which is available now, and it contains a rationale for this work. And currently we are working on something that is coming very soon, and this is the guide for the development and implementation of these services, which again contains justification and rationale for the services, some history of the development of these services and the results that organizations achieved across the world. Then we also explain how to do outreach and marketing of these services, what is the spectrum of services and how to organize them, and also some practical things around the team composition and knowledge and skills that the team require to be able to effectively provide these services. And the guide will also have the collection of cases, mostly from our region, illustrating this intervention. So please be in touch with us to be able to get this document as soon as possible. Next slide, please.
That's the last one.
Yeah, that's the last one. So this one is just to thank you. And the picture here is actually the demonstration of what we call trip sitting. And we can tell you more about this. But essentially, this is providing people with psychosocial support they require when they face challenging state related to the use of substances. And this is probably the second most demanded service after drug checking among the community of people who use. So my colleagues will give you more details and more illustrations, but again, I'd like to highlight that we expect that we stay in touch and work on practical issues to help organize the services, to learn from you as well, because we are learning, and to get funding for this important work. Thank you very much.
Thank you very much, Slava. And so today we will be focusing after this introductory presentation on some practical experience from the region. There isn't much going on, but we have managed to bring together people who are doing work in this direction. And our next speaker is Irena Molnar, who is the Executive Director of Regeneration, an organization based in Serbia, and who has experience of working in this area, and will be sharing with us today this experience with an emphasis on work at the festivals. Thank you and welcome, Irena. And sorry, just one quick comment. The chat function as such is actually not working for everybody for the questions, but there is a Q&A section on the panel at the bottom of your screen where you can post your questions and where we can track them and react to them. Sorry about that. Thank you and welcome, Irena.
Hi, thank you, Maria. Thank you, Slava, for the introduction. And yeah, thanks to Alliance for involving us and also Drug Policy Network Southeast Europe in this important work. As Slava said, yeah, this was the common work of many of us. So I'm really hoping that that soon we're going to present the manual that we can talk later on. I saw, Elisa, your question, and it is different than the other ones, but we will explain it later. Yeah, so I just briefly want to mention that NGO Regeneration exists for 12 years now, and we've been doing and focusing mostly and only at the beginning on sustainability and implementation of nightlife outreach programs, not only at the festivals, but also in clubs and generally throughout nightlife. And yeah, mostly what Slava already mentioned, we've been facing so far, especially related to the legal constraints of providing our services and going around them in order to be able to provide them. So Regeneration is not only doing outreach services, we're also doing advocacy and research actions, and working with young people and with peer workers to be providing different services that Slava already mentioned, but I will go in that a little bit later. Can I have the next slide? Thank you. So my presentation will mostly focus on to set the scene, to understand where we are when we say Balkans and Southeast Europe. So I will be going a little bit wider than the Balkans, and will mention some organizations from Southeastern Europe and the needs for harm reduction services and drug checking services around the area. So, I mean, when we're talking about nightlife and we're talking about festivals, the definition of a music festival can really be different things. So it can be large scale events, but it can also be smaller local gatherings, and it can definitely vary music wise. So we don't really, most of the organizations and most of the things that we're talking right now will consider electronic dance music scene, but I also want to stress now that we've been doing one amazing research in 2015 that showed us that type of music did not necessarily mean that people are using or not using substances. It just means that they might be doing different substances, but the substance use is always somehow present. So when we talk about the Southeast Europe region, we have a significant number of music festivals, and they're ranging from all different genres and sizes. And I don't know how much you know about specific festival, but the Exit Festival is one that lasts the longest and is one that is also present in Montenegro and Croatia and Romania at the moment. So they have their sister festivals around the region. We do have Modem, which is one of the most popular psytrance festival that is actually organized by people from UK. So we have also different interventions from different actors in the nightlife scene. So not everything is organized from us by us. So region is very fluid and very, how to say, very diverse in that section. So we also in Croatia have Outlook, maybe Dimensions, also festivals run by the UK organizations. We do have festivals in Albania right now. We have Romania, Electric Castle, and all of them are like several thousand people festivals. But I'm not going to mention little and small festivals and parties that we have in practically right now in Serbia. I think this summer we had the festival in each bigger city, meaning that we have over the summer maybe 10 or 12 festivals that are happening. And this number is big. This number is big in terms of amount of available nightlife events, which I really support and I like. But I think that promoting safety, health, and well-being at the music festivals is crucial for everybody there. So not only attendee protection, but we also need to think about the public health and harm reduction, mental health support, environmental sustainability, which I don't think that we're mentioning enough when we're talking about this. But also when you ask festival organizers, they need to think about reputation and long-term successes of events. So the stakeholders in this specific topic are various, and we need to take that into account when discussing this topic, because it's not only it's everybody involved, and everybody needs to feel that it's included in discussion about it, and everybody needs to be included and in setting up the scene for implementation of harm reduction programs. So everybody needs to be okay with everything that happens, because only in that way, I see in the Balkans that only then we're going to have the quality provision of services that we currently lack. So when it comes to harm reduction strategies at the moment, in the region, we have several organizations that I will mention later on, but mostly it happens that organizations are one who were starting the services on their own expenses and because they think it's important, but also there are festivals who are organized by the foreign actors or stakeholders, so they are having services on their own organized by the people who are not from the region. So for example, we have Modern Festival that has trip sitting and harm reduction service, but most of the people are coming from Psycare Austria or Psycare UK. So they lack people who are even speaking Croatian or Serbian or Bosnian, but also the public is international. So if for them is enough to speak also English only. So there, I think this also varies from the country that the festival happens, because for Slovenia, for example, they have in law written statement that they need to have some kind of harm reduction service, and it depends which is it a festival or is it a party. It depends on the amount of people who will have to support and provide education or what type of service they will have, because they do have drug checking that Slava was mentioning that operates for many years now. Can I have the next slide? The previous one. Thank you. So what do we have as risks and issues? There are many. So most of the Balkans, most of the Balkan countries, or the Western Balkan countries, are struggling with the legal and regulatory issues with the harm reduction programs. For example, in Serbia, we have a law that says that facilitation of drug use or helping somebody take drugs is a criminal act. And in that sense, providing drug checking, providing different like sniff materials, or even sometimes providing different materials for people to stay safer when using drugs can be seen as facilitation of drug use. This is why us, for example, are finding different ways and providing services up to that limitations in order to have at least something, because it was not always easy, also due to political situation that is pretty unstable in the Balkans, and most of the, drugs are always political issue here. And in that sense, it was quite hard to find a common ground with the decision makers, specifically in Serbia, to provide drug checking services, even though we do have efforts and we're waiting for a better political climate that we probably will have in the spring next year. There is huge stigma and resistance surrounding harm reduction services and drug checking in the region, and it mostly comes from organizers, and it also comes from the decision-making bodies, specifically Ministry of Interior and police is not so keen to have these services, being that it's not legal to sample, the same as Slava says, but also providing reagents kits can be seen, and we received the comment from judiciary that it might be facilitation of drug use, so they do not advise us to do that. So far, we as an organization were not crossing that line yet, because we felt that we need to build sustainable network with all stakeholders, because as I said, yeah, politically it can be very dangerous. What we were discussing and what Slava also mentioned are the limited resources. So funding limitations and lack of dedicated staff or volunteers and training in harm reduction also is something that makes organizations that are providing harm reduction services to set part of their resources, part of the stuff to actually implement something that will be harm reduction for recreational drug users and nightlife. That being said, yeah, most of the drug-related services are focused on HIV exclusively, specifically for the Balkans, and the Global Fund funding still is only funding the funding that goes to key populations, which in some terms, if you ask our decision makers, young people doing drugs in festivals are not. And in that sense, it's very hard to take parts of the money or take hold of the teams to actually provide services. But this is why for us was easy, because we focused only on this type of services. But I can understand that due to lack of specific funding for this, and I'm not mentioning small scale funding for 6 or 5 or 9 months. Talking about sustainable funding for actual services that will be sustainable, that will follow development and be sustainable and be monitored and evaluated. And this can be like 5-year plan or 7-year plan, but it should be something that it's not only 3 months or 6 months and 5,000 euros, because not much you can do for that money and in that time. Another huge issue, I guess, for Serbia definitely is the public health and safety protocols that are not being respected. So every country in the Balkans, and probably, everywhere, has its own protocols and safety protocols, and also public health protocols, but not only. Most of the festivals and most of the big clubbing events, even in Belgrade, are not respective of those. So, for example, we have close to 5,000, 6,000 festival or nightlife party in the middle of Belgrade, but we do have little toys inside of the venue, and also not available running water in it. So you can imagine that there is several festivals that also struggle with at least running water, who is a basic human right. And it is hard to navigate and hard to discuss even with the organizers why that should be available, because most of the earnings comes from selling water, right? So we've been, I think, privileged to now lead the discussion with some of the decision makers, and also with some of the organizers, and we hope that by the next year we're going to be able to actually provide them with the training and also with the necessary resources and skills for implementation of also all of this, all of these. So I didn't ask for the next slide, but I'm just going to briefly mention the emergence of the NPS in the region. So as we know, and NPS are present, and what we lack is the basic information on types of the NPSs happening here. So us in Serbia, we can learn about emergence of NPS only when somebody ends in the hospital, somebody is arrested and on the borders. So most of the time we don't even know what people are using around, because we don't have drug checking services and there is no way to find out. Our post system also functions like that we're not able to send samples to anybody. And if we do it as an organization, we can be criminally charged. So in that sense, our hands are tied and it's unable to actually know. We've been developing the system of improvement of the early warning system for NPS here in Serbia with the help of Eurasian Harm Reduction Association. And that project was effective and still effective in a way that we developed some protocols that we discussed with the crucial stakeholders here, including police. And some of the laboratories that we have here in Serbia are very interested to continue that cooperation, but still, due to unstable political situation at the moment, we are waiting for the time for that to be cleared out a little bit more, so we can actually find political support as well, because this is what it's needed when you're advocating for change of policy here in Serbia. So what we can do, and what I see that we can do and that we can discuss further on, of course, is to establish effective collaboration and cooperation with the local authorities, law enforcement, health services, and that can be crucial for providing harm reduction services. So not necessarily us as organizations do need to do all of the things that we are mentioning. Some of the things can also be done by the partners in this crucial bodies. I understand, and we also from the experience know that administratively, bureaucracy is something that it's killing the will for fighting to provide these type of services. But I think that if we do need that if we do implement the needs assessment and we do find stakeholders and map people and organizations and ministries, even in the local governments, not only on the national level, but maybe on a municipal level, this can be crucial for implementation of the services that we actually saw by implementing services in city of Vršac, which we were supported by Red Cross of Vršac and also state. In that sense, campaigning and advocacy on all of the levels is necessary, not only to inform festival goers about the available services, which is definitely not enough done here in Serbia, but we do not have we do not have services on each and every festival in order to discuss that, but also we need to discuss benefits of the services, not only to festival goers, but also to providers of the organizers of the festivals, but also police and also Red Cross, also ER services and different stakeholders, because I don't know, in the time of our work, we did hold trainings also for the Red Cross and for a couple of festivals that were happening here in Serbia, we did implement something together with them. Impact and effectiveness, so harm reduction services and drug checking is something that we did throughout of the several projects. And as we do not have drug checking services yet implemented, we've been communicating success stories from other countries and other partners. We've been lucky to have also EMCDDA or European Drug Agency people to help us in communication of that to our governments. So I think that not only pressing from the ground, but also pressing from the international stakeholders, such as European Agency or UNODC, can be crucial for implementation of such services, or at least regulating how it should be done. I know that this is a big work, and this, for us, it happened over 5 or 6 years right now. But I think finally we have some common ground, but also some plan on how to do it in the future. So funding for it, before we secure funding for it, I think it won't be possible. But I strongly advise that all of these discussions are communicated throughout the strategy and action plans. I don't know if where you come from, but here in Serbia, we are now discussing the next strategy, or that will be a program under the public health strategy, but still we are there to secure space and time to discuss also involvement of harm reduction services for recreational drug use, and also we're discussing possibility of having drug checking at least mentioned before. If it's not mentioned in the strategical documents, I think our governments have intention to just ignore it, or say we don't have it in strategic documents, so we cannot do anything for it. In that sense, yeah, I think for us was beneficial to always have representation in the bodies who are actually discussing this type of documents, which I think for us now is a middle point in discussing how we're going to secure funding and implementation and legal aspects of it.
Dear Irena, sorry, 1 minute left, please. Oops, we can't hear you now. Something happened.
Can I have the next slide? And that's my last. So I just briefly wanted to go through some organizations that we feel as a good practice examples from the region. Stefan will talk later on about what Regeneration is doing, but what we do is an outreach, information sharing, education, peer-to-peer education. We do trip sitting in certain events, not on all events, and all of the services basically are depending on what type of the event we are actually providing the service at. So we will not provide same service at the, I don't know, LGBTQR or queer party, or at the Psytrance Festival if we are going to do one. So we're going to talk with the organizers and actually provide service that they feel their crowd is needing. So newly established, not so newly, but established organization from Croatia is Trip Sitters, and they're also providing outreach information, education, peer-to-peer trip sitting, condoms, and different materials for harm reduction. I have to say that I am very happy that they are finally providing services of really amazing festivals around Croatia. This is the organization that Regeneration provided with the training when they were established. And after a couple of years and after COVID, we finally can see that they are providing services. One of the best examples that we have in the region is Drogart from Slovenia, who are actually the first and still the only organization in Southeast Europe, excluding Greece, because they are now sharing reagents test kits. That Drogart is the only organization actually providing drug checking services at the moment, in collaboration with the government as well. And we're all learning from them and having their support in developing this type of services in our country. And yeah, last but not least, I want to mention organization Generation Act, that Regeneration is collaborates right now. This is I think the newest organization that exists, and they're founded last year in Athens in Greece, and they're providing services in Athens and Thessaloniki. They are sharing religious test kits at the moment, and they also have the outreach services. And this is, I'm happy that Athens and Thessaloniki finally do have organizations such as this, because they were needing one for such a long time, and finally they have one. And I will be happy to share my presentation with everybody who wants it, and also my contacts for the people who are interested to learn more about our experience and how to work on this. Thank you. This is it.
Thank you very much, Irena. And thank you everyone for your questions and comments. We are trying to reply to them and react as we go along, but if we don't, we will try to cover them at the end. We hope to have some time for discussion. And our next presenter is Halina Sergeyenko from APH, who is the creativity force behind drugstores. So we are going back to the Eastern European side of the region, and Galia will Ukrainian experience and touch on some of the promo materials that will be the video cases to support the guide that Slava mentioned. Thank you and welcome, Galina.
Welcome, everyone, and I'm happy to see you at this workshop. Hopefully, it will be helpful. I'm not going to speak now about importance and how relevant the programs are and how important it is to implement them. We are grateful to speakers. They presented it very well, but let me speak about our Ukrainian experience of providing harm reduction services for people who use PAS in the recreational context. In drugstore project, let's go to the next slide. Thank you. So a couple of words about drugstore project and about the principles that the project is grounded. What helps us do make our services stable and comprehensive, what helps us reach our target audience and other goals. So at the next slide, you will see a short promo video.
Заюш, із цим чекетом тобі пряма дорога в зону турбулентності.
Не зрозумів.
Зараз поймеш. Лей.
Ти...
І я, стюардеса Анжела. Я дбаю про твою безпеку. Дізнаюсь, що там всередині.
Літаєш без стюардеси? Про безпеку подбає Drugstore. Зменшення шкоди від вживання психоактивних речовин, сексуальне здоров'я, психічне здоров'я. Перш ніж юзати, щоб уникнути отруєння чи передозування, перевір речовину за допомогою спеціальних реагентів Drugstore. Дізнайся, як безкоштовно отримати реагенти для перевірки психоактивних речовин на нашому сайті та соціальних мережах Drugstore. Підтримай Drugstore, зробивши внесок на сайті.
Let me tell you a little bit about Drugstore. We launched the project in 2018, and the objective of the project is similar to objectives of similar organizations globally. This is about development of safe behavior models and the conscious attitude to mental and sexual health of users, of young people, and development of humane drug policy in Ukraine. One of our key objectives when we developed the project was to set up something that is not like the classical social projects, both visually and ideologically in the sense of content. We excluded such theses as that it is harmful. We do not prohibit anything. We say that everything is possible, but you need to be reasonable when you do that. We make it possible for the audience to make a choice, and we share checked information, speaking about positive and negative aspects of consumption of psychoactive substances and other high-risk practices. So we can go to the next slide. Here you can see all the services that we provide, and that's free anonymous counseling, educational materials, and harm reduction kits that we distribute by mail. We developed this practice during COVID times, and that made it possible for us to keep providing services for our clients, harm reduction services. And this is the prevention kit. And further on, during the war, during the full-scale aggression, that made it possible for us to continue implementing our projects and to provide these services to clients. We also conduct offline and online lectures and trainings for organizers of events. We organize podcasts, other educational videos, more than 1 million views on YouTube channels. One of our services is, of course, a support at music events and entertainment events. We also developed harm reduction programs for MSM community. There we distribute party boxes for harm reduction, which also proved to be quite a success, and we continue implementing this program. We also we held several surveys that made it possible for us to better understand needs of our clients and to find some arguments to continue, extend the programs, to prove it to donors that it's necessary. We also have the Telegram bot on overdose with information about overdose of very psychoactive substances and what to do in case of overdose. Also, we have all kinds of social media. Then I'd like to speak in more detail about certain services, and let's go to the next slide. This is a video. As you can see, we use provoking design and content in order to attract the audience. This is about word of mouth, especially for young people. That's important. We are not boring. We engage modern artists. We follow the trends. We use interactive methods. Here you can see the sections that we have on our website. This is about us with quite detailed information on our values, our services, where in which aspects they can contact us, what we can do together. Also on our website, there is the service of counseling, and this is very popular. We have a lot of success stories, cases where we were able to help people. And I don't know if you see the video, but okay, so this is about psychologists, psychiatrists, services, infectionist doctor available from our website, services of a PAS expert where any user can anonymously and free of charge contact us via the chat. There are the working hours of these experts. Another entry point, this is free to ask application in Apple Store and Google Play. Our users can contact us in that way as well. We also have this map. You will see it in the video further on with helpful addresses where it is possible to have HIV testing. The map. And also on the website, we have a test that attracts attention of the user to health, sexual health aspect, and to that it is important to undergo testing and take care of oneself. And here you can browse for information, as I mentioned, about all aspects of consumption, sexual, mental health, all of that is available on our website. And this is the test, as I mentioned. Here you can also see the page with certain questions where it is possible to quickly address them. Recently, we developed a page with donations. We do fundraising. We try to support our program independently because funding is not always enough to cover our needs and needs of our clients. Next slide, we can go to the next one. Here you will see how we approach advertising of our counseling service. This is the same slide, but now let's go to the next one. Can we go to the next one, please?
Привіт. Ось ми і залишились удвох. Я Олена чи Олень? Так, у принцес теж свербить. Вчителька мікрорайону нашого жителька. Експонат. Зніми рожеві окуляри. Називай мене Домінатрікс. Танцюю, значить існую. Та хто я?
Бу! Заюш, будь собою.
Літаєш без стюардес?
Все ще літаєш без мене? Про безпеку подбає Drugstore, зменшення шкоди від психоактивної пригоди, хорні і здоров'я у нормі. А ще менталочка заюш. Отримай професійну психологічну допомогу на сайті drugstore.org.ua, а також у додатку Free to Ask, доступний на Google Play і Apple Store. Це анонімно та безкоштовно. No shade. Підтримай Drugstore, зробивши внесок на сайті. З мене цьомик.
So another service that we provide, that is working at festivals and parties. We also started doing that more or less at the same time when we launched our website. As Irina explained, we also encountered certain misunderstanding. We try to arrange it with organizers, event organizers. So initially we had to explain why, who we are, why we are needed. And that took certain time. But now, and this is a success story, now event organizers, festival organizers, they understand that presence of drugstore at the party where there is harm reduction service, and we also held HIV testing at festivals. They understand that this is about caring about guests of the events or parties. We attended parties from 8,000 people to smaller, much smaller ones, like 150 people. And what we do at those parties, we distribute prevention materials, classical preserve condoms and lubricants. Before the war, during large parties, we also did HIV testing at parties, which was also quite welcomed by organizers and guests. We distribute tests to check psychoactive substances, colorimetric agents, as mentioned by Mr. Kushakov, and also we distribute one-time kit for nasal use for sniffing of as also our merch, stickers, information about us, so that people could use our videos, could come to us for consultations, and we also distribute vitamins, electrolytes that we developed with a diet nutrition expert, considering that a person may consume psychoactive substances. That's also very popular among visitors of festivals, and they express their gratitude to us for that. And also, before the war, we provided trip sitting service. Why I say before the war? Because previously there were these festivals that lasted for days and during the nighttime where people needed psychosocial support. Now, despite the invasion, we still see quite a significant number of parties. In the recent 6 months, we've supported and we've been present at more than 64 events. Organizers now invite us proactively, as I mentioned, and that's a win and a success. Let's now, well, let's not watch the video. Let's go immediately to the next. Let's go to the next one. This is our promo video. I wanted to attract your attention to the fact that in our communication strategy, we use visual materials. We try to attract our audience there. And also on the website, you can see our bus that we use at festivals and parties. Guests of festivals love it. They like making photos with the bus and then publish that on social media. Due to that, due to our visual materials, we create organic growth for our audience. And in the next slide, you will see the other side of this multi-band. And as you can see, the pictures, the visual materials are non-standard, outstanding, bright, and that helps us to increase visibility for our audience, and that helps us disseminate information about us with our audience.
The next slide, yeah, unfortunately, we will try to watch this video as this video is important and interesting and it covers the main principles that we've been following while creating our party box prevention kit. But we used the same principles creating any product of ours. That's the quality, content, and the visual quality, of course, plus links and using a lot of communication channels. Let us try to watch it. Anyway, this video will be available later in our manual because there was a question about what would be the difference. Yes, in the manual, I would like to add a little bit to that the manual will be different because it will not be too different, but it will include also new successful cases, including the party box delivery by mail. That's something that makes your service available. That's something that ensures customized approach to every customer, and something that allows you to start at the drug scene. So it's all in this case in this video. Let us try to watch it. Easy access to the harm reduction kit.
Party Box –
The Party Box is a preventive product created for recreational consumers of psychoactive substances as a part of the Drugstore project. Drugstore is an educational prevention project established in 2018. Our goal is to reduce the harm and risk associated with the consumption of psychoactive substances, sexual education, HIV prevention, preserving the mental health of young people. Every party box contains the following components: condoms and lubricants for safe sex, reagents for testing substances. They help to detect unexpected and dangerous substances in the sample. We select reagents individually based on the specific needs of each participant. Also, a QR code with a link to a video instruction explaining how to test substances at home can be found in the party box. There are also some other useful things: electrolytes, a set of vitamins composed by nutritionists allowing to restore the body's losses during and after taking psychoactive substances. It's important that the client understands that maintaining the balance of electrolytes in the body is necessary on a constant basis. Rapid test for HIV, it is added to the set depending on the individual needs of the customer. Individual snuffing set for nasal substance use, branded stickers and promo materials of the project, such as drugstore keychains, bright and unfoldable materials that suit everyone regardless of gender and age. Simplicity, convenience, and attractiveness are mandatory characteristics of a party box. The content of the party box should be brightly designed and make user want to get it and tell his friends about it. The products must contain logos, website addresses, and QR codes that lead to online pages of the project. When creating the set, it's also worth emphasizing modern trends, such as environmentalism or charity. This increases the customer's loyalty to the brand, such as cardboard instead of plastic sniffing tubes, or the QR code on the card leading to the website that helps homeless animals. Search and work with the client. Create an anonymous survey form to get initial information, what the customer uses and what kind of help he needs. This way, you'll get a basic profile of your client. During the survey, the client must receive a unique code with which they apply to your project for services. The code will guarantee the confidentiality of the service provision. Look for the right communication channels with the people needing your services. Expand advertising in social media and other informational spaces. Establish and maintain reliable contact with different segments of your target audience. Analyze survey data to improve your service. communicate with the clients through secure messengers, clarify orders, and offer additional services. Using the automated online services enables you to offer the party box to the client before the survey. From the outside, the party box looks unremarkable. We don't want it to draw needed attention. The packaging of any product from an online store can look the same. It is compact and does not require much space. The party box. Participation in the program does not expose the client to additional risks. The service is available without client identification, possibility of individual selection of the necessary means of prevention and harm reduction, studying of the client needs and individual risk, and automated formation of a set of necessary means of prevention using modern solutions for communication and data processing. Maintaining confidential contact with the client for the purposes of the long-term participation in the program. Informational support and additional services enable getting the maximum benefits from participation in the program and achieve effective substance use harm reduction. Program outreach grows without additional investment in the advertising. Thanks to organic marketing, we will help you develop your version of the party box. Contact us and visit our website. I'll stop on this slide, I think, because I don't have a lot of time. So the video about the party box illustrates the main principles we use, creating our strategy for interaction with the clients and shaping our program. On this last slide, you can also see where we are. We are available. We are on the social media, Instagram, Telegram. We have a Telegram bot. We have TikTok. We have YouTube channel. We have SoundCloud, where we invite modern DJs. Thus, we also communicate with the audience. We try to be everywhere, try to use as many communication channels as possible. And now one of our main victories is the fact that we've really been able to create this safe space for users of psychoactive substances. We've been able to expand our services to reach the audience. They're very they show a lot of gratitude. They respond to what we offer, and we involve some of our clients in creating the program as well. You can use this in your strategies too, because quite often drug users can help you with creating designs. They can give you donations, so they will provide you with discounts for their services. And well, briefly speaking, that's it for the drugstore project. Of course, the biggest concern of ours is advocacy. It's a dialogue with law enforcement agencies, but we don't give up. We continue this dialogue. We develop a political strategy, and we hope that soon we will be able to use better methods for drug checking. So thank you very much for your attention, and I'm giving the floor again to Maria. Yeah, I'm giving the floor to the next speaker. Unfortunately, we've not been able to show all the videos, but I know that we will share the presentation and you will be able to check what methods we use in our strategy.
Thank you very much, Galina. Yes, indeed, we will be sharing the presentations, and the videos are included in Galina's presentation, so you will be able to go back and take a look with a better quality and in your own time. We can see that some hands are up. Please kindly type in the chat, in the Q&A box, your question and who you are, where you're from, and we will try try to respond in the box or discuss it at the end. Also, at the end of the webinar, there will be a short survey, a couple of questions about what topics that we covered were the most relevant and what you would like to hear in our potential future events. So please do take a minute before exiting the event to go through those questions. And I would like to present the next speaker. This is, we are back to the Balkan part of the region. Stefan Page, Program Coordinator from Regeneration, will talk about a new initiative, Safe Party. Thank you very much, Stefan, and welcome.
Thank you so much, Maria. Hello to everyone from me. Today, I will be presenting our new program, Safe Party. And I have seen some questions in the chat that I hope will answer during the presentation. But if I maybe miss something, please use the Q&A session and I will get back to that. And also, Irena will be sending you some links as I speak to some different to some different guides or so-called rule books or protocols and stuff like that that you might use that we have been using during the making of the Safe Party. So the Safe Party program is a comprehensive approach to harm reduction in nightlife and recreational settings. And what does that actually mean? We know that there are a lot of different risks when it comes to nightlife. And we are not only talking and addressing the recreational drug use, we are also talking about all the other different aspects of safety in nightlife. That means prevention of heat stroke, prevention and response to gender-based violence, of course, harm reduction when it comes to drug use, preventing different health risks that might be related to somebody's hearing or generally how to respond in possibly risky situations. So we can go to the next slide. We will talk a little bit more about what this program looks like. So it is firstly focused on raising awareness among different stakeholders. Like my colleagues previously said, the topic of recreational drug use, and especially in nightlife settings, is a fairly new topic for pretty much everyone in the region. But since we have started our work in regeneration, that has been more than 10 years ago, the topic of safety in nightlife settings was our focus. And we understand that without raising awareness among partygoers, event organizers, decision makers, it will be really hard to actually approach these things and offer some kind of answers or responses to the different needs. So one of the biggest things, like Irena said, was the decision makers and the fact that recreational settings up until this point aren't recognized in our strategic documents. And that's something that we have been working on to change. Hopefully that is going to change with the new program for combating drugs. And during the official launch of this program this year, we've actually had a colleague from the Office for Combating Drugs talking about the importance of actually tackling this question and responding to it as it is getting more and more prominent. When it comes to actually providing services and what we are doing within this program, I will talk briefly about the team composition and how we have organized ourselves in different settings. So based on the scale of the event, we are doing kind of different things, but generally speaking, we have a team that is working on the info stand, providing information on harm reduction, gender-based violence, sharing harm reduction kits. Well, that team is kind of like the first step that we are doing, and also that the party goers or festival goers are kind of having like the connection with us. One of the primary ideas behind that is education and prevention. Another team is working on the ground, so to speak, and they are going around the venue, checking if everyone's okay, if something needs something, and they are also referring people to the info stand. They're also sharing like party packs, which are small Ziploc bags filled with basic harm reduction information, condoms, lubricants, clean papers, alcohol wipes, so people can actually, and earplugs, so people can actually start implementing harm reduction steps right away. And when we are working on large-scale festivals, we also sometimes have a PsyCare or a trip sitting team that are working with people who are having bad experience, or just everything is kind of too much for them. It is too intense. So they have a space where they can chill a little bit, and people who are there to talk to them and offer some support. Another thing that we are working on is trainings, and we have trainings aimed at different stakeholders. So pretty much we are working with party goers for them to understand all of the risks that might be included in nightlife, but also how to prevent them and how to deal with them. But we are also working with DJs, nightlife staff, and organizers for them also to understand what could possibly happen, and before the event even starts, how to prepare for possible risky situations in order to actually better respond to them. And I will be talking a little bit more about those trainings in a bit. We can go to the next slide. So when it comes to service provision, Irena has briefly mentioned that we don't have drug checking services in Serbia. So what we can and can't do is, well, really, we have a small area that we can work on, which is pretty much education and kind of like going around those fine details. So we can't really be giving out clean papers for sniffing explicitly, but we can say on our little leaflet that using paper bills or plastic straws and sharing those with other people is a health risk because of all the possible reasons and risks involved, and that if they choose to take drugs nasally, that it would be better to use some kind of a clean paper. And then magically you have some clean papers in the party pack. So we're kind of like in the gray area, but so far it has been working. It is also helping that we are closely working with the Office for Combating Drugs, and they kind of have our back because they do understand the importance of our work. One of the things that when it comes to service provision, that we don't see very often happening in different events is actually prevention and response to gender-based violence. And that was one of the things that we wanted to address. So there are different risks involved in the nightlife settings, and gender-based violence is very, very prominent. During the implementation of the Sexism Free Night project for the past few years, we have been working on making different protocols and trainings for nightlife professionals, harm reduction professionals, and also event organizers to actually tackle this question and offer some of the possible responses to those. Last year, during the Boom Festival in Portugal, we have actually piloted the protocol on prevention and response to gender-based violence, and we've had a whole team that was responsible for that. And I have to say that the response from the people that were at the festival was amazing. And we have seen that these kind of services are really necessary to have. One of the biggest things that we always address when it comes to nightlife is that there are different risks involved. So we're not just speaking about the health risks that always come to mind first, but we are also talking about different social and legal risks that people might face. And one of the things that we want to accomplish is actually the behavior change. So by educating people on different risks, we kind of hope for them to change their behavior or start actually critically thinking about what, how, and where they're doing things, how they can stay safe, and how they can actually help others if they are in need. For that to happen, I really think that it is important to have a multi-sectorial approach, because safety in general, like I said, is not connected to just one thing. And we really can't tackle this issue with just one kind of approach. So we have to work with different stakeholders and on different levels in order to actually have a better response to this. I think that Irena has shared with you the links to the training manuals for the Sexism Free Night project. So we have three of those different, and also there you can find a protocol when it comes to gender-based violence, but also like the minimum quality standards for nightlife organizers specifically. At the moment in Serbia, but I think the whole region, or at least the Western Balkans, it really is important to kind of start thinking and implementing the minimal quality standards, as right now it's kind of left to totally left to organizers and venue owners, and they're not really thinking about the safety of their guests, but are mostly thinking about the economic value that they are bringing. But actually, without the safety of everyone involved, I don't think that nightlife can be safe for everyone. And I think that would be it. I'm gonna go check out the Q&A part and answer all of the questions if needed. And yeah, if you have any more questions, I guess we can do that after. Thanks a lot.
Thank you very much, Stefan. Yes, Irena did send a couple of links. I copied them into the Q&A section on Eliza's question on GBV, and we will be sharing them as well in a follow-up email with the materials to the webinar, so everyone will have a chance to have a look. So thank you very much to all of the participants and to all of the speakers. Now we have a chance to respond to any questions that have been left unresponded, or if you have any additional ones. So please do raise a hand. There is a raise a hand option at the bottom of your screen on the panel, and we will make you a panelist and you will be able to speak. In the meantime, please, I would like to ask Slava maybe, Slava, to elaborate on one of the questions in the chat regarding some of the results of the harm reduction work that you were speaking about. I think that could be interesting and helpful. Thank you.
Thank you very much, Maria. So as far as results are concerned, it's important to highlight that one of the important results is actually creation of the rapport with the audience. So the trustful relationship with the community is a very important achievement of this program, and essentially the amount of positive feedback we are getting on the work is enormous, and we are crying when we are reading the comments from people on our services. And this relates to many things, starting from actually facilitating the development of awareness of the issues related to substance use. And you know, after taking part in our surveys, people are actually thanking us for highlighting the importance of these issues that they never thought about in the past. So it actually creates more conscious relationship with substances and more conscious attitude to harm reduction as well. So there are plenty of other things, because the spectrum of services is large, and one important thing is mental health counseling, and this is a very popular service among young people, and our psychologists never sit without work in this regard, addressing issues related to depression, anxiety, relationship challenges, etc., etc., and even advising people on how to get humanitarian assistance during war and this kind of stuff as well. As far as the changes in behavior are concerned, there are more and more articles published and studies conducted in this regard, and you can see some of them. There was a special issue on drug checking published in the journal on drugs, alcohol, and social responses. I probably confused the title, but we can give you a reference. And one of the articles was actually related to Ukrainian experience. related to our work during festivals, and among the other things, including information on the drug scene that was published for the very first time as far as recreational use is concerned. We also found some changes in behaviors, and people who obtained the negative or unexpected results when they checked their substances with reagents were 2.5 times more likely to not to use the substance than people who obtained positive results, results that confirmed that the substance was what was thought it was. So I already give reference to this particular publication on Ukraine, but there are more and more studies coming and in the pipe. So the amount of evidence, I'm sure, will soon result in WHO recommending the services for broader introduction. Thank you very much.
Thank you, Slava. I can see Gala's hand up. Maybe you'd like to add onto that, please.
Да, Мария, спасибо. Я хотела бы еще раз подчеркнуть важность онлайн-работы, поскольку не всегда потребление веществ связано только с электронными фестивалями электронной музыки или другими развлекательными мероприятиями. Как раз, да, чем нам помогает наша психологическая поддержка. У нас было несколько кейсов, когда потребители уже к нам обращались в состоянии после употребления психоактивных веществ. Это депрессивные состояния, это суицидальные практически состояния, где мы могли перенаправлять потребителей, продолжить лечение, либо как-то простроить план действий на будущее. Также мы можем путем онлайн-работы коммуницировать и запобегать, боже, как это на русском, предотвращать переход с назального употребления, например, на инъекционное употребление. У нас были такие кейсы, когда к нам обращались, и это снова онлайн. Также, да, важность того, что люди к нам обращались после того, как рассылки пати-боксов и говорили: спасибо большое, мы не стали употреблять то вещество, потому что после проверки его калориметрическими тестами поняли, что оно, ну, это совсем не то вещество, что нам продали. Как бы это довольно ощутимые результаты, возможно, их нельзя зафиксировать конкретно, да, каким-то, но я думаю, что это большое количество спасенных жизней, передозировок, от перехода к более рисковому поведению и других рисковых практик, потому что эти сервисы невероятно важны, особенно для молодежи, когда еще нет устоявшегося сформированного мировоззрения, и мы не понимаем, куда идти и что делать. Спасибо.
Thank you very much, Galina. Just a quick reminder, all attendees, all participants have an opportunity to raise their hand for last-minute questions. And one last question from my side, maybe Irena, you could just tell us a little bit about an offline intervention, about specifically trip sitting, just a couple of words of clarification on what that is for those who may not be familiar. Thanks.
Yeah, thank you. So like practically trip sitting or psych care is supervision of other people's difficult experiences on mostly psychedelics. So that means that there is a team of trained people that are taking care of the other people who are having difficult situations during their psychedelic experience. That can be various things. But usually what aim of that service is to just ensure that people are safe. They're safe mentally, they're safe emotionally. So providing care in those terms for people who are struggling at that point is critical for also for later on and for preventing the later on trauma that people can actually suffer from in those situations. So we've been doing that with the Cosmic Care team last year at Boom. Together with, so Regeneration had part of the team doing psych care and part of the team doing drug checking. And in between, we did have consultations and combinations also related to gender-based violence that occurred in both of the teams in several cases. So also the teams were and should be trained also to do gender-based violence response in trip sitting, because we also figured out that a lot of our experiences in regenerations also were kind of associated with possible cases. So yeah, in general, yeah, it also it for sure ensures that people are safe mentally, emotionally, and physically. And yeah, this is the most broader aim of it. Did I answer that correctly? I mean, was this enough?
Yes, thanks so much. I'm pretty sure this is a good description. Thank you. And we have one more question. I don't know if Victor Vozian, you would like to voice it, or it will be faster if I voice it, since yeah. I was not here from the beginning. Perhaps it was already covered. What is the legal framework for drug checking in Ukraine in comparison to Balkan contexts? Thanks. I would kindly ask someone from the speakers, maybe Slava, to just remind us on this, or touch base upon it briefly. Thanks.
So difference between Ukraine and Balkans.
In terms of legal framework for drug checking, what's the specificity in Ukraine in comparison to Balkans?
Well, the countries are different, and I think in some aspects, in Ukraine, probably there are fewer regulations. So as far as distribution of liquid reagents, for example, which is not possible in some of the other countries, we can still do it, but it can be regulated to the negative side at any time. So we should work on the policy front to make sure that it's still possible to do it, and also to expand the number of options. But the general feature is the same for all countries. It's still criminalized, and the regulations still create barriers for the delivery of services. So that's why it's very important to exchange the results of this work and use not only results from developed countries, but also use results from our region as well. And kind of pile up the arguments that we have for policy and advocacy work. Well, it's a very general answer, but thank you.
Thank you very much. I don't see any more hands, and I don't see any unanswered questions in the chat. Eliza, I can see some links to materials. Thank you very much. We'll be sure to include these in the follow-up message to all the participants. I would like to thank one more time all of our speakers for this incredible, interesting, and engaging presentation, and thank all of our participants for the interest and for finding the time to join us today. We are always here and happy to share any details or any further information that might be of interest. Please do reach out, and we will keep in touch, and we will follow up with presentations and videos and additional links after this event to all of the participants. Thank you very much, and have a good rest of the day and rest of the week.
Thank you.
Thank
you very much.
Thank you.
Thanks, bye.
Thank you very much. Bye.